Good evening. Welcome to the public hearing on the EESER 3 in-person instruction and continuity of services plan. On behalf of the entire school board, I would like to thank you for sharing your comments this evening with us. The hearing is being broadcast on channel 99 and live streamed at fcps.edu/tv/ch99. We have 3 registered speakers who will address the board at this public hearing. Speakers are allotted 2 minutes, and we ask that you stay within that time limit. The timer will start when you begin to speak, and the timer will sound after 2 minutes, and your remarks must address the EESER 3 plan. If you have not registered to speak but would like to address the board, please see the clerk to sign up for one of the 5 extra reserved speaker slots. Madam Clerk, please call our first speaker.
Madam Chair, can we certify closed session?
Yes, before we get started, we need to certify our closed meeting. So in order to comply with section 2.2-3712D of the Code of Virginia, it is necessary for the board to certify that since the Fairfax County School Board convened a closed meeting on April 27, 2023, to the best of each member's knowledge, only public business matters lawfully exempted from open meeting requirements, and only such public business matters as were identified in the motion convened the closed meeting were heard, discussed, or considered by the board during the closed meeting. Do I have a motion? Ms. Corbett-Sanders, do I have a second? Ms. Omesh, all those in favor? That is Ms. Pekarsky, Dr. Anderson, Ms. McLaughlin, Ms. Jarnett-Kofax, Ms. Tolan, Ms. Corbett-Sanders, Ms. Omesh, Ms. Marin, Ms. Keys-Gamarra, and myself. That motion passes. Thank you very much. Ms. Cohen and Mr. Frisch have submitted a written request to virtually attend this evening's meetings due to medical conflicts. All those in favor of granting these requests, please raise your hand. Ms. Keys-Gamarra, Ms. Marin, Ms. Omesh, Ms. Jarnett-Kofax, Ms. Tolan, Ms. Corbett-Sanders, Ms. McLaughlin, Dr. Anderson, and Ms. Pekarsky. That motion passes. Welcome, Ms. Cohen. Mr. Frisch, can we please do a mic check? Can we please do a mic check, Ms. Cohen?
Hi, guys. Thanks.
Thank you. Can mic check, Mr. Frisch?
Hello.
Great. Welcome. Thank you very much. And I'll turn it over to Ms. Tolan to do our public hearing.
I believe we are ready to call our first speaker.
Our first speaker is David Walrod. Our next speaker is Greg Shapiro.
Hi, my name is Greg Shapiro. I am a dedicated volunteer advocate supporting the Washington, D.C.-based indoor air quality pathogenic mitigation advocacy organization. Our sole mission is evaluating tomorrow's IAQ PM technologies for today's IAQ PM issues that optimize the health, performance, and well-being of students, employees, and the vulnerable community living with risk factors year in and year out. The COVID-19 pandemic served to expose, amplify, and bring to the forefront the decades-long IAQ PM issues in schools, nursing homes, and public facilities that have resulted in physical, mental, and social economic negative consequences from a nationwide shutdown that could have otherwise been avoided if our nation were prepared. The White House is already leading the IAQ PM change initiative as they understand the ethical mandate for the public and private sector decision makers to address the IAQ PM issues, leveraging billions of federal and state grants available through the American Rescue Plan. The value our IAQ PM advocacy group provides was having already invested the time and expertise in inventing the best IAQ PM technologies, centered around effectiveness, energy and efficiency, long-term operational costs, and the most importantly, the technology results must be on-site, third-party lab verified, using in-depth industry-leading testing protocols that provide empirical data. After completing our IAQ PM technology evaluation process, our IAQ PM advocacy recognizes the MaxClean 756 system is providing foundational long-term value by meeting above all of the strict evaluation criteria set forth. Please refer to the Indoor Air Quality Organizational Memorandum issued by our Executive Director, detailing Max Clean 756 foundational long-term value proposed based on pandemic-driven updated safety and compliance standards. This is FDA-approved green technology. Thank you.
Thank you. Our next speaker is Vanessa Hall.
Hi, there's not very many of us, is there? So I'm speaking about mental health. 1 in 6 kids, 6 through 17, experience a mental health disorder each year, and unfortunately, suicide is second only to gun violence as the leading cause of death in young people. So I have to say, I really appreciate what you've done with the ESSER 3 funds for counselors, psychologists, social workers, and family liaisons to support students' social and emotional needs. Your choice to put social and mental health first will literally save lives. Even before 2020, schools were facing a surge of demand for mental health care that far outpaced capacity. Since only about 15% of students have access to mental health care outside of school due to the limited number of youth psychologists, significant cost, and other access issues. Across the nation, faculty are often first responders due to limited availability of counseling. Thus, I also appreciate your efforts to train more mental health first aiders. This 8-hour training has enabled me to be the best student-focused volunteer I can be, whether it is in school, with youth groups at my church, or with my scouts. I wish more adults were student-focused and understood how their behavior affected student mental health, safety, and academic excellence. Our adult words and behavior trickles into schools. I've heard, pardon my language, the F slur is commonly used against LGBTQIA students. It's shouted in the halls, at individuals, and at other activities, which feels threatening. How can students learn, much less thrive, in and out of school if they feel unsafe? As Ms. Togby says, students are watching and they're listening. We need to set a good example, be kind, speak truth, support students and teachers, and identify both issues and solutions. Merely complaining does nothing, but coming up with workable solutions means the world to our county. Thanks so much.
Thank you to our speakers. Do we have anyone else? Thank you to our speakers for sharing your comments this evening. The public hearing is adjourned. The board will take a 10-minute break before convening the regular meeting.